I'm Pamela Hartling. I'm a social worker at Northwood Care Incorporated in downtown Halifax. Um, One of the things that I think about feedback is that it should never be a surprise. If a supervisor is meeting with a student on a regular basis, which I think should happen, and picking up on things as they go along, no constructive feedback should ever be a surprise to the student. And I think that's one of the most important things for me. Evaluation is a very important part of any program, any course, any study. And I think that this is where the value to the student comes in. Students should have the opportunity throughout the time in the agency to know where there is need for improvement, where they have done well, and where they need to go before any final evaluation happens.
I'm John O'Keefe, and I'm manager for social work at Northwood as well. And I think one of the important points that Pamela made was the use of the phrase constructive when it pertains to feedback, because sometimes students and even preceptors might perceive feedback with a negative connotation, but if it's offered in the spirit in which it's intended, it should be perceived by the student as an opportunity to enhance their learning, and that's certainly the way that we present feedback to the students who we have the privilege of being preceptors for, and that's usually outlined early on in the relationship between the preceptor and the student, that the purpose of the placement is to create a learning environment, and feedback works both ways, that we're looking for feedback as well from the students that are involved in this agency, asking them for reactions in terms of our practice and the programs and services that we provide, and sometimes students have been able to enhance the delivery of service with innovative suggestions. As far as evaluation is concerned, we certainly have criteria that we're trying to evaluate students against. We want to ensure when they finish their practical experience that they're equipped to go out into the workplace and function as competent healthcare professionals. So we're trying to equip them with the skills and a bit of a toolkit that they need to be able to go out and make positive contributions to their profession, and the only way to do that is to evaluate them against certain professional standards.
I also think that the preceptor learns as much for themselves and their own education as the student in an ideal situation. One of the reasons that I like to supervise a student is because it challenges me to develop professionally as well.
In terms of the health profession that we represent, we do have the opportunity, and there's also an expectation that we're providing input into the final evaluation of the grade for the student. In our case, it's a pass or a fail. So we're looked to be able to provide evidence that the student has actually met certain criteria for the profession, and we need to take that very seriously because we want to ensure that people that are going out to practice in the field are competent and caring professionals.